Read the report carefully. Then answer the following 4 questions to determine how you would treat this patient. We have a 71-year-old female who is alert and oriented to stuff in place, just admitted to the med-surg floor for CHF exacerbation. She uses a walker and has bathroom privileges. Now, I know what you're thinking. It's not a lot of information, but guess what? You can do a lot with it. Some diets this patient might be on are heart healthy and a low sodium diet. For focus assessment, you should be thinking cardiac and respiratory. Some patients with CHF may have respiratory issues due to fluid leaking into the lungs. This can cause them not to be able to ambulate as far as they used to. They may need to take frequent rest breaks, so we want to make sure that we assess respiratory. We want to assess for edema by looking at the patient's legs. They may be swollen or they may have pitting edema. Make sure that you read up on that. If the patient has edema, educate them to decrease their sodium intake and to keep their legs elevated. If you have a patient with CHF, it's important to know that usually they are a daily wait when they are in the hospital. And this is yet another way to just keep up with if they are holding fluid or not. You should also want to assess the patient's med compliance because discharge planning occurs on the first day that the patient is admitted. We want to make sure that the patient is taking the medications as prescribed. Oftentimes, patients with CHF are prescribed a diuretic, which makes them urinate a lot. Some patients don't like constantly getting up to the bathroom, so they may not take this medication. So let's find out if they're compliant or not. And because this cardiac issue is very important, I would want to take an apical heart rate because it is the most accurate. So the apical heart rate should be part of your focus assessment. There is more than one correct answer to these questions, but as for me, when I'm reading this, I'm thinking that I would like to assess her safety. So why am I thinking like this? I'm thinking like this because she was just admitted to the floor. No one really knows her. She's also alert and oriented to herself and to place. She's not alert and oriented times 4. So I kind of want to just double check and see what's going on, make sure that she's not very confused. She uses a walker, which lets me know that her gait is unsteady, and she has bathroom privileges. So because she has bathroom privileges, that means she's going to be getting in and out of bed whenever she feels the need to go to the bathroom. I need to know if her walker is close to her bed. I also need to make sure that her bed is not in a high position. I would hate for her to try to get out of the bed and her bed is up high. So we also need to make sure that she knows how to use the call light in the bathroom in case she needs any type of assistance. And again, she is new to the floor, so it's very important to assess safety.